What if I told you that the plain water you're drinking right now might be making your heart work harder than it needs to? You've probably been told your whole life to drink 8 glasses of water a day. Stay hydrated, they say. It's good for you, they say. And yes, water is essential. But here's the truth no one talks about. After 50, plain water isn't enough. In fact, drinking water without this one critical mineral could be leaving your heart starving for what it needs most. And the fix? It's sitting in your kitchen right now, costs pennies, and takes 5 seconds to add. Let me explain. Here's what's happening inside your body right now, and you probably don't even realize it. Every single heartbeat, and your heart beats about 100,000 times a day, requires a spark of electricity, not the kind that comes from an outlet, but electrical signals that tell your heart muscle when to contract and when to relax. This electrical system is so precise, so perfectly timed, that even a tiny disruption can cause problems. Now, after 50, something changes. Your body doesn't hold on to minerals the way it used to. Your kidneys, which have been filtering your blood non-stop for 5 decades, start becoming less efficient. Medications that many of us take, blood pressure pills, diuretics, even antacids, they're quietly flushing out essential minerals. You're drinking water, sure. But that water is passing right through you, taking vital nutrients with it instead of delivering what your cells desperately need. The result? Your heart has to work harder. Your blood pressure might creep up. You feel more tired in the afternoon. Maybe you get muscle cramps at night, or your legs feel restless. Perhaps you've noticed your heart occasionally skips a beat, or you feel a flutter in your chest that wasn't there before. You mention it to your doctor, and they say, "Well, you're getting older." As if that's supposed to be helpful. But here's what most people don't realize. Your heart isn't failing because of age. It's struggling because it's running on empty. And the fix is so simple, so incredibly straightforward, that when I tell you what it is, you might think, that can't be it. But it is. Let me take you inside your heart for a moment. Imagine your heart as an electrical pump. Every beat starts with an electrical signal that travels through specialized pathways, triggering muscle cells to contract in perfect sequence. First, the upper chambers squeeze, pushing blood down. Then the lower chambers contract powerfully, sending blood throughout your entire body. This happens roughly once every second, all day, every day, for your entire life. Now, these electrical signals don't just happen by magic. They're created by the movement of minerals, specifically charged particles called electrolytes, moving in and out of your heart cells. Think of it like this. Your heart cells are like tiny batteries. When minerals flow in and out through microscopic doorways in the cell walls, they create the electrical charge needed for each heartbeat. The master mineral controlling this entire electrical system? Magnesium. Here's where it gets fascinating. Magnesium is like the orchestra conductor of your cardiovascular system. It doesn't just sit there passively. It actively regulates over 300 different chemical reactions in your body, and more than 600 different proteins depend on it to function. In your heart specifically, magnesium controls the flow of calcium, potassium, and sodium, the 3 other minerals that create those electrical signals. Think of calcium as the on switch for your heart muscle. When calcium rushes into your heart cells, the muscle contracts. That's good, you need that. Okay? But if calcium stays inside the cell too long, or if too much calcium floods in at once, your heart muscle can't relax properly. It's like trying to open and close your fist repeatedly, but your hand keeps cramping up because the muscles won't release. This is where magnesium becomes absolutely critical. Magnesium is the off switch. It gently escorts calcium back out of the cell, allowing the muscle to relax completely before the next beat. When you have enough magnesium, this dance between contraction and relaxation is smooth, efficient, and effortless. Your heart beats in a steady, powerful rhythm. Your blood pressure stays balanced because your blood vessels can relax between heartbeats. Everything flows. But after 50, your body's magnesium levels start dropping. And here's why. First, your kidneys don't conserve minerals as efficiently as they used to. If you're taking a diuretic for blood pressure, which millions of people over 50 are, you're literally peeing out magnesium every single day. Second, chronic stress, which seems to accumulate as we age, burns through magnesium rapidly. Every time you experience stress, your body dumps magnesium to handle the crisis. Third, the soil our food is grown in has become depleted of magnesium over the past 50 years, meaning even a healthy diet might not provide enough. So what happens when magnesium levels drop? Your heart cells become electrically unstable. Calcium starts overwhelming the system because there's not enough magnesium to control it. Your heart muscle can't fully relax between beats. Blood vessels become stiff and constricted instead of flexible and responsive. Your heart has to pump harder to move blood through tighter vessels. That's when blood pressure rises. But it gets worse. Without adequate magnesium, the electrical pathways in your heart can misfire. You might feel palpitations, that sensation where your heart seems to skip a beat or flutter. Some people develop atrial fibrillation, where the upper chambers of the heart quiver irregularly instead of beating in rhythm. Others experience that uncomfortable pounding sensation, especially at night when lying down. The blood vessels throughout your entire body are also affected. The smooth muscle cells lining your arteries need magnesium to stay relaxed and flexible. When magnesium is low, these vessels constrict, making it harder for blood to flow freely. It's like trying to water your garden through a hose that someone has kinked. The pump, your heart, has to work so much harder to push water through that restricted passage. Now, imagine this happening 100,000 times a day, every single day. Your heart never gets a break. The constant strain starts showing up in other ways. Fatigue because your tissues aren't getting enough oxygen-rich blood. Cold hands and feet because circulation to your extremities is compromised. Brain fog because your brain isn't receiving the steady blood flow it needs. Even poor sleep because your body can't fully enter that relaxed, restorative state. And here's the connection most people miss. When you drink plain water, especially in large quantities, you're actually diluting the minerals already in your bloodstream. Your body has to work to maintain the precise balance of electrolytes in your blood. If you're drinking water without replenishing magnesium, you're like a person bailing water out of a leaky boat, constantly working but never actually solving the problem. That's why after 50, hydration isn't just about water volume. It's about giving your body water plus the minerals it needs to actually use that water effectively. Your cells are like dry sponges. Plain water alone can't fully rehydrate them. But water with the right minerals, that's absorbed efficiently, delivered where it's needed, and actually supports the cardiovascular system instead of just passing through. So here's what I want you to do, starting tomorrow morning. Take your glass of water. Room temperature is actually better than ice cold for absorption. And add a 1/4 teaspoon of magnesium. Not magnesium oxide, which passes right through you. Not magnesium citrate, which can cause digestive upset. I'm talking about magnesium glycinate, or magnesium chloride, forms that your body can actually absorb and use. Just a 1/4 teaspoon dissolved in 8 to 12 ounces of water. Stir it up. Drink it slowly, preferably in the morning and again in the evening. That's it. 2 simple glasses of magnesium-enriched water per day. Now here's what happens inside your body when you start doing this consistently. Within hours, yes, hours, that magnesium begins entering your bloodstream. It travels to every cell, including your heart cells, and immediately gets to work. The electrical system in your heart starts stabilizing. Calcium, which may have been overwhelming your heart muscle cells, gets balanced out. Your heart can finally relax completely between beats. Think of it like this. Your heart has been clenching like a tight fist for months or even years. Now suddenly it can open fully, relax deeply, and then contract powerfully. The rhythm becomes steady and strong instead of erratic and forced. Within a few days, you'll notice that fluttering sensation in your chest happens less often, or stops entirely. That pounding heartbeat you felt at night, it calms down. But the benefits go far beyond just your heartbeat. Remember, magnesium affects over 300 processes in your body. So as your magnesium levels rise, you experience a cascade of positive changes. Your blood vessels, all 60,000 miles of them throughout your body, begin to relax. The smooth muscle cells lining these vessels have been tight and constricted, but magnesium acts like a natural relaxant. The vessels soften, widen, and become more flexible. Blood flows more easily. Your heart doesn't have to pump as hard to circulate blood through your system. Many people see their blood pressure drop by 5 to 10 points within a couple of weeks. That might not sound like much, but it's the difference between a heart working overtime and a heart working efficiently. Circulation to your extremities improves dramatically. Those cold hands and feet you've been dealing with? Suddenly they're warm again. That's not magic. It's simple biology. Blood is finally reaching your fingers and toes because the vessels aren't constricted anymore. Some people tell me their hands and feet literally tingle for the first few days as proper circulation returns. It's like that feeling when blood flow returns to a limb that's been asleep, except it's a good thing. It means your circulation is waking up. Your energy levels begin to climb. Here's why. Every cell in your body produces energy in tiny structures called mitochondria. Think of mitochondria as microscopic power plants. These power plants need magnesium to function. Without adequate magnesium, your cellular energy production drops. You feel tired, sluggish, like you're running on a drained battery. But when you restore magnesium levels, those mitochondria fire up again. Energy production increases. You wake up feeling more refreshed. That afternoon slump at 2 or 3 p.m., it starts disappearing. You have stamina that carries you through the entire day. Sleep quality improves in a profound way. Magnesium helps regulate your nervous system, shifting you from that fight-or-flight sympathetic state into the rest and digest parasympathetic state. This is the state where deep restorative sleep happens. Many people over 50 struggle with staying asleep. You fall asleep fine, but then you wake up at 2 a.m. and can't get back to sleep. Or you sleep, but never feel truly rested. Magnesium changes this. It helps your brain produce GABA, a neurotransmitter that calms nervous activity. You fall asleep easier, stay asleep longer, and wake up actually feeling restored. Muscle cramps and restless legs, those annoying symptoms that wake you up at night, often disappear completely. Remember, magnesium controls muscle contraction and relaxation throughout your entire body, not just your heart. When levels are adequate, your muscles can release tension properly. No more Charlie horses in your calves at 3 a.m. No more restless, uncomfortable sensations in your legs when you're trying to relax. Your mood stabilizes. This isn't just about feeling physically better. Magnesium directly affects your brain chemistry. It helps regulate the stress hormone cortisol, keeping it from spiking unnecessarily. It supports the production of serotonin, your brain's feel-good chemical. Many people notice they feel less anxious, less irritable, more emotionally balanced. That underlying tension you've been carrying, the kind that makes you snap at small annoyances or feel overwhelmed by normal daily stress, it softens. Brain function sharpens. Your brain uses about 20% of your body's blood flow, so when circulation improves, your brain benefits immediately. Better blood flow means better oxygen delivery. Better oxygen delivery means clearer thinking. That mental fog you've been attributing to getting older, it starts lifting. You remember names more easily. You can focus on tasks for longer periods. Reading doesn't feel as exhausting. You feel mentally present instead of constantly distracted or forgetful. Your exercise recovery improves dramatically. After 50, you might have noticed that workouts leave you sore for days. Or maybe you've stopped exercising because the recovery is just too brutal. Magnesium changes this equation. It helps muscles repair faster, reduces inflammation, and prevents the excessive lactic acid buildup that causes deep muscle soreness. You can actually enjoy physical activity again without paying for it with 3 days of painful recovery. Digestive function becomes more regular. Magnesium helps relax the smooth muscles in your digestive tract, allowing everything to move along at the right pace. Not too fast, not too slow. Just regular and comfortable. Many people dealing with occasional constipation find that this issue resolves naturally when magnesium levels are adequate. Your body's inflammatory response becomes balanced. Chronic low-grade inflammation is one of the main drivers of aging and disease. Magnesium has natural anti-inflammatory properties. It doesn't suppress inflammation entirely. You need some inflammation for healing and immune function, but it prevents the excessive, damaging inflammation that contributes to heart disease, joint pain, and accelerated aging. Here's something else remarkable. Magnesium helps your body produce and utilize vitamin D more effectively. Many people supplement with vitamin D, but without adequate magnesium, your body can't convert that vitamin D into its active form. So you could be taking vitamin D supplements and still be functionally deficient. But when you ensure adequate magnesium intake, suddenly that vitamin D works the way it's supposed to, supporting bone health, immune function, and even mood regulation. The best part about all of this? You're not adding a complicated supplement regimen. You're not taking handfuls of pills. You're simply enhancing the water you're already drinking with a mineral your body desperately needs. It's elegant. It's simple. It works with your body's natural physiology instead of trying to override it with synthetic medications. And let's talk about cost. A container of quality magnesium powder costs about $15 to $25 and lasts 2 to 3 months. We're talking pennies per day. Compare that to prescription medications for blood pressure, heart rhythm, or sleep. Medications that often cost hundreds of dollars per month and come with side effects that require additional medications to manage. This isn't about replacing necessary medications. Never stop taking prescribed medications without consulting your doctor, but about supporting your body so naturally that it might eventually need less pharmaceutical intervention. The timing matters too. Take your first glass of magnesium water in the morning, preferably 20 to 30 minutes before breakfast. This allows the magnesium to be absorbed without competing with other nutrients. Your body gets an immediate supply to start the day with proper electrical balance in your heart. Then take your second glass in the evening, about an hour before bed. This supports that transition into restful sleep and ensures your heart has adequate magnesium through the night when your body does most of its repair work. Some people ask, can I just take a magnesium pill? You can, but there are advantages to dissolving it in water. First, absorption is often faster and more complete when magnesium is in liquid form. Second, you're hydrating at the same time, which your body needs to actually use the magnesium effectively. Third, spreading your magnesium intake across 2 doses throughout the day maintains more stable levels in your bloodstream, rather than one spike from a single pill. Now, let's go deeper into why this matters so much specifically after 50, and how magnesium connects to other crucial systems in your body. Your heart doesn't work in isolation. It's intimately connected to your kidneys, your nervous system, your hormones, and your metabolism. When one system struggles, the others compensate. And after 50, this interconnected web becomes more fragile. But here's the beautiful thing. Supporting one key system, your cardiovascular system with magnesium, creates positive ripple effects throughout your entire body. Let's talk about your kidneys first. Your kidneys are extraordinary organs. They filter about 50 gallons of blood every single day, removing waste, balancing fluid levels, and regulating mineral concentrations. But kidney function naturally declines with age. By age 70, most people have lost 30 to 40% of their kidney function compared to their 20s. This isn't disease, it's normal aging, but it has consequences. When your kidneys are young and strong, they're excellent at holding on to minerals like magnesium while filtering out waste. But as kidney function declines, they become less discriminating. They start losing magnesium in the urine, even when your body needs to conserve it. This creates a vicious cycle. Low magnesium stresses your heart and raises blood pressure. High blood pressure puts more strain on your kidneys. Damaged kidneys lose more magnesium. Round and round it goes. Breaking this cycle with supplemental magnesium is one of the smartest moves you can make. You're compensating for what your kidneys can no longer do efficiently on their own. It's not a sign of weakness. It's smart biology. You're working with your body's changing needs, not denying them or fighting them. Now, here's something most people don't realize. Magnesium is crucial for balancing the other major heart minerals: potassium, calcium, and sodium. These four minerals work together like a finely tuned quartet. If one is out of balance, the whole system suffers. Potassium, for instance, is essential for normal heart rhythm. It works opposite to sodium. Sodium triggers heart muscle contraction, while potassium helps with relaxation and recovery. But here's the catch. Your body can't properly use potassium if magnesium is low. Magnesium acts like a gatekeeper, helping potassium enter your cells and stay there. Without adequate magnesium, you can eat all the bananas and sweet potatoes in the world, high potassium foods, and still be functionally potassium deficient because the potassium can't get into your cells where it's needed. Many people over 50 take potassium supplements or eat potassium-rich foods to support heart health. That's good. But if they're magnesium deficient, they're not getting the full benefit. Fix the magnesium deficiency, and suddenly your dietary potassium becomes much more effective. Your heart rhythm stabilizes. Muscle cramps decrease. Blood pressure regulation improves. Calcium is another critical player. You need calcium for strong bones, yes, but you also need it for heart muscle contraction. However, and this is crucial, you need calcium in the right place. You want calcium in your bones and in controlled amounts in your cells when they need to contract. You do not want calcium accumulating in your arteries, forming plaque that stiffens blood vessels and restricts blood flow. Magnesium is the mineral that keeps calcium where it belongs. When magnesium levels are adequate, calcium gets directed to your bones and teeth. It enters heart muscle cells in precise amounts, triggers contraction, and then gets escorted back out. But when magnesium is deficient, calcium goes rogue. It starts depositing in arteries, creating calcification, those hardened plaques that cardiologists worry about. It floods into heart muscle cells in excessive amounts, causing irregular heartbeats and incomplete muscle relaxation. This is why some research shows that magnesium supplementation can help slow or even reverse arterial calcification. It's not removing calcium from your bones. It's preventing calcium from depositing where it shouldn't be. Your bones stay strong, but your arteries stay flexible and clear. That's the balance you want. Sodium often gets vilified in conversations about heart health. Reduce your sodium, doctors say. And yes, excessive sodium can contribute to high blood pressure, especially if you're sensitive to it. But sodium isn't the villain. Imbalance is the villain. When magnesium, potassium, and calcium are all in proper balance, your body can handle reasonable amounts of sodium just fine. It's when these minerals are out of whack that sodium becomes problematic. Magnesium helps your body maintain sodium balance by supporting kidney function and regulating the hormones that control sodium retention. When magnesium is adequate, your kidneys effectively eliminate excess sodium. When magnesium is low, sodium retention becomes more likely, contributing to fluid retention, bloating, and elevated blood pressure. So rather than obsessing over every grain of salt, focus on ensuring mineral balance. Get adequate magnesium, eat potassium-rich vegetables, and don't stress about reasonable salt intake. Your body knows how to handle sodium when the other minerals are properly balanced. Let's talk about the nervous system connection. Your autonomic nervous system, the part that operates without conscious control, has two branches: sympathetic, fight or flight, and parasympathetic, rest and digest. Ideally, these two branches balance each other. You activate the sympathetic system during stress or activity, then shift into parasympathetic mode for recovery and restoration. But after 50, many people get stuck in sympathetic overdrive. Chronic stress, hormonal changes, poor sleep, and yes, mineral deficiencies all contribute to this imbalance. You feel wired and tired at the same time, exhausted but unable to truly relax. Your heart rate stays elevated even at rest. You startle easily. You feel anxious or on edge for no clear reason. Magnesium is critical for shifting back into parasympathetic mode. It literally calms nervous system activity. It helps your body produce GABA, that calming neurotransmitter I mentioned earlier. It regulates the HPA axis, your body's stress response system, preventing cortisol from spiking unnecessarily throughout the day. When your nervous system is balanced, your heart doesn't have to work as hard. Your resting heart rate drops to a healthy level. Your heart rate variability, a marker of cardiovascular fitness and nervous system health, improves. You feel calm but energized, relaxed but capable. That's the state your body is designed to operate in most of the time. Hormonal changes after 50 also affect magnesium needs, especially for women. Estrogen helps the body retain magnesium, so as estrogen levels drop during menopause, magnesium deficiency becomes more likely. This is one reason why so many women experience heart palpitations, anxiety, sleep problems, and blood pressure increases during perimenopause and menopause. It's not just hormones, it's the mineral deficiencies that hormone changes trigger. Supplementing with magnesium can significantly ease this transition. Many women report that symptoms they attributed entirely to menopause, hot flashes, night sweats, mood swings, palpitations, improve dramatically when they address magnesium deficiency. You're not reversing menopause, but you're supporting your body through it much more gracefully. For men, testosterone levels naturally decline after 50, which affects magnesium metabolism too. Lower testosterone is associated with reduced magnesium levels, and interestingly, low magnesium may contribute to accelerated testosterone decline. Ensuring adequate magnesium supports healthier hormone balance, better muscle maintenance, improved energy, and yes, better cardiovascular function. Let's discuss blood sugar and metabolism because this connects directly to heart health. Magnesium is essential for insulin function. Insulin is the hormone that helps glucose enter your cells to be used for energy. When magnesium is deficient, cells become resistant to insulin. Glucose can't enter cells efficiently, so it stays in your bloodstream. Your pancreas pumps out more insulin trying to force glucose into cells, but it's like knocking on a locked door. The door won't open without magnesium acting as the key. This insulin resistance leads to elevated blood sugar, which damages blood vessels over time. The sugar molecules in your blood essentially caramelize the proteins in your vessel walls, making them stiff and prone to plaque formation. Your heart has to work harder to pump blood through damaged, inflexible vessels. Meanwhile, your pancreas is exhausted from overproducing insulin, eventually leading toward prediabetes or type 2 diabetes. Adequate magnesium keeps this entire system functioning smoothly. Insulin works effectively. Blood sugar stays stable. Blood vessels remain healthy. Your heart isn't stressed by the inflammatory effects of high blood sugar. Many studies show that people with higher magnesium intake have significantly lower risk of developing type 2 diabetes. And for those who already have diabetes, magnesium supplementation often improves blood sugar control, sometimes allowing for reduced medication. The inflammation connection deserves special attention. Chronic inflammation is like a slow-burning fire throughout your body, damaging tissues, accelerating aging, and increasing disease risk. It's now understood that inflammation is a primary driver of heart disease, even more important than cholesterol in many cases. Magnesium has powerful anti-inflammatory properties. It reduces the production of inflammatory molecules like C-reactive protein, CRP, and interleukin-6, IL-6. It supports the production of anti-inflammatory compounds that help your body resolve inflammation naturally. When magnesium levels are adequate, inflammation stays at appropriate levels, enough to fight infections and heal injuries, but not so much that it damages your tissues. Reducing chronic inflammation protects your heart in multiple ways. It prevents damage to the endothelium, the delicate inner lining of blood vessels. It reduces the likelihood of plaque formation in arteries. It prevents the plaque that does exist from becoming unstable and rupturing, which is what triggers most heart attacks. Essentially, magnesium helps keep your cardiovascular system in a state of repair and protection rather than damage and deterioration. Your muscles throughout your body, not just your heart, need magnesium for optimal function. After 50, maintaining muscle mass becomes increasingly important. Muscle isn't just about strength and appearance. It's metabolically active tissue that helps regulate blood sugar, supports bone health, maintains balance and mobility, and even affects longevity. Magnesium supports muscle protein synthesis, helping your body build and maintain muscle tissue. It reduces exercise-related inflammation and oxidative stress, allowing faster recovery. It prevents excessive muscle cramping and tension. When you can exercise comfortably, recover well, and maintain muscle mass, your overall cardiovascular health improves dramatically. Exercise strengthens your heart, lowers blood pressure, improves circulation, and enhances mood. All the things magnesium directly supports. Bone health is intimately connected to heart health, though most people don't realize it. Magnesium is crucial for bone formation. About 60% of your body's magnesium is stored in your bones. It works alongside calcium and vitamin D to maintain bone density. But here's the connection to heart health. The same factors that weaken bones, chronic inflammation, hormonal changes, poor mineral balance, also damage blood vessels and stress your heart. Osteoporosis and cardiovascular disease often occur together because they share common root causes. Supporting bone health with magnesium simultaneously supports vascular health. You're addressing both issues with one mineral. Your bones stay strong, your blood vessels stay flexible, and your heart doesn't have to fight against stiff arteries and systemic inflammation. There's even emerging evidence about magnesium's role in DNA repair and cellular aging. Your chromosomes have protective caps called telomeres, which shorten with age and stress. Short telomeres are associated with increased disease risk and accelerated aging. Magnesium appears to support enzymes that protect and maintain telomere length. While this research is still developing, it suggests that adequate magnesium might support healthy aging at the most fundamental cellular level. All right, let's get practical. You understand the science. You know why this matters. Now here's exactly what to do, starting tomorrow. First thing in the morning, before coffee or breakfast, prepare your first glass of magnesium water. Use 8 to 12 ounces of room temperature or warm water, not cold, because your body absorbs minerals more efficiently from water that's closer to body temperature. Add a 1/4 teaspoon of magnesium powder. I recommend magnesium glycinate, if you want the most absorbable form with zero digestive issues, or magnesium chloride, if you prefer a slightly more cost-effective option that's still highly absorbable. Avoid magnesium oxide. It's cheap, but your body barely absorbs it, and it tends to cause bathroom urgency. Stir the powder into the water until it's completely dissolved. Some forms dissolve instantly. Others take 20 to 30 seconds of stirring. Don't rush this. Sit down, take a few deep breaths, and drink it slowly over 5 minutes. Let your body absorb it gradually rather than gulping it down. Wait 20 to 30 minutes before eating breakfast. This allows the magnesium to be absorbed without competing with other minerals and nutrients from food. During this time, you can do some gentle stretching, prepare breakfast, meditate, or simply enjoy a quiet moment. Make this part of your morning ritual. Not a chore, but a moment of self-care. In the evening, about an hour before bed, prepare your second glass of magnesium water, using the same method. This dose supports your nervous system's shift into sleep mode and ensures your heart has adequate magnesium during the night when repair processes are most active. Again, drink it slowly and mindfully. If you're currently taking any medications, especially blood pressure medications, diabetes medications, or diuretics, talk to your doctor before starting magnesium supplementation. Magnesium doesn't typically interfere with medications, but your doctor might want to monitor your levels, especially if your blood pressure starts improving. You might eventually need lower medication doses, which is a good problem to have. Start with this basic protocol for 2 weeks and pay attention to how you feel. Keep a simple journal if you want. Note your energy levels, sleep quality, any heart palpitations or irregular beats, how your muscles feel, your mood, and your overall sense of well-being. Most people notice improvements within days, but some changes take a couple of weeks to become apparent. After 2 weeks, assess your results. If you're seeing benefits but want to optimize further, you can gradually increase to a half teaspoon twice daily, which provides a more therapeutic dose. Listen to your body. Some people do beautifully on a 1/4 teaspoon twice daily. Others need a bit more. The maximum you should take without medical supervision is about 400 to 500 milligrams per day from supplements, which is roughly half to 3/4 of a teaspoon of most magnesium powders, depending on the specific product concentration. One note about digestive tolerance. Magnesium draws water into the intestines, which is why magnesium citrate is sometimes used as a laxative. If you experience loose stools, you've exceeded your body's absorption capacity. Simply reduce your dose slightly. Magnesium glycinate is much less likely to cause this issue, which is why I recommend it for most people. Support your magnesium supplementation with dietary sources too. Dark leafy greens, spinach, Swiss chard, kale, are excellent magnesium sources. Pumpkin seeds are extraordinarily rich in magnesium. Just a 1/4 cup provides nearly 200 milligrams. Dark chocolate, the real stuff, at least 70% cacao, contains significant magnesium. Avocados, black beans, and fatty fish like salmon and mackerel all contribute to your magnesium intake. But here's reality. Even with a perfect diet, getting optimal magnesium from food alone is challenging after 50 because of reduced absorption and increased losses. So don't feel like supplementation means your diet is failing. You're simply compensating for your body's changing needs. Hydration matters beyond just the magnesium water. Aim for adequate overall water intake throughout the day, usually around half your body weight in ounces. So if you weigh 160 pounds, aim for 80 ounces of water total. But here's a tip. Add a tiny pinch of sea salt to 1 or 2 glasses of water during the day. This isn't about drinking salty water, just enough that you can barely taste it. That trace amount of sodium helps your body actually absorb and retain the water instead of just peeing it out. It provides trace minerals beyond magnesium, and it supports proper hydration at the cellular level. Exercise becomes easier and more beneficial when magnesium levels are adequate, so pair this protocol with movement. You don't need intense workouts. After 50, consistency matters more than intensity. Walking 30 minutes daily, swimming, gentle yoga, Tai Chi, or resistance training 2 to 3 times per week all support cardiovascular health. The magnesium helps your muscles recover, reduces post-exercise soreness, and allows you to actually enjoy movement, rather than dreading the aftermath. Sleep hygiene pairs beautifully with evening magnesium. Keep your bedroom cool, dark, and quiet. Avoid screens for at least an hour before bed. The blue light interferes with melatonin production. Consider the evening magnesium water part of your wind-down routine, along with dimming lights, perhaps some gentle reading, and setting an intention to release the day's stress. Stress management is crucial because stress depletes magnesium rapidly. Find practices that work for you: meditation, deep breathing, time in nature, creative hobbies, connection with loved ones. When you manage stress effectively, your magnesium stores last longer, and the supplementation you're doing works even better. Monitor your progress over months, not just weeks. Take note of your blood pressure if you check it regularly. Track how often you experience palpitations or irregular heartbeats. Notice your energy levels, sleep quality, muscle cramps, mood, and mental clarity. These are your real markers of success, not blood tests or numbers, but how you actually feel living your daily life. Consider asking your doctor to check your magnesium levels if you want objective data, but understand that standard blood tests only measure serum magnesium, the amount in your bloodstream. This represents less than 1% of your body's total magnesium. Most magnesium is inside cells or stored in bones, so blood tests often appear normal, even when you're functionally deficient. Red blood cell magnesium testing is more accurate, but not commonly ordered. Ultimately, how you feel is the best indicator. Be patient with your body. If you've been magnesium deficient for months or years, full replenishment takes time. You'll notice some benefits quickly, but deeper improvements, like significant blood pressure reduction, complete resolution of palpitations, or dramatic changes in exercise capacity, may take several weeks or even a couple of months. Trust the process. Your body is healing and rebalancing. Give it the time it needs. Your heart has been beating for you every single second of your life. After 50, it's beat billions of times. It's never stopped, never taken a break, never complained. It deserves your support, not through expensive interventions or complicated protocols, but through something so simple it almost seems too easy, giving it the mineral it needs most to function effortlessly. This isn't about fighting aging. You're not trying to turn back time or reclaim your 20-year-old body. This is about honoring where you are right now and supporting your body's natural wisdom. Your body knows how to maintain cardiovascular health. It knows how to regulate blood pressure, maintain steady heart rhythm, and circulate blood efficiently. It just needs the raw materials, the minerals, particularly magnesium, to do what it's designed to do. After 50, health isn't just about adding years to your life. It's about adding life to your years. It's about having the energy to play with grandchildren, travel to places you've always wanted to see, pursue passions you set aside during your working years, and simply enjoy each day without being limited by fatigue, pain, or fear about your heart. Sky-high heart health doesn't mean your heart is perfect or that you'll never face health challenges. It means your heart is supported, strong, resilient, and working with you instead of against you. It means you're not wondering if every flutter or skip is something serious. It means you can climb stairs without getting winded, wake up with energy, and go to sleep with gratitude. This simple practice, adding magnesium to your water twice a day, is your foundation. Build on it with good food, joyful movement, stress management, and connection with what matters most to you. But start here. Start with giving your heart what it's been asking for, possibly for years. Tomorrow morning, when you prepare that first glass of magnesium water, pause for a moment. Place your hand on your heart. Feel it beating. Thank it for its relentless service. And then give it the support it deserves. Your body has carried you this far. With this one simple change, you're empowering it to carry you forward with strength, vitality, and confidence. After 50, it's not just about survival. It's about thriving. It's about living fully, feeling strong, and trusting your body. You deserve sky-high heart health, and now you know exactly how to support it. The choice is yours. The power is in your hands, or rather in your water glass. Here's to your heart. Here's to your health. Here's to everything that lies ahead for you.